Before proceeding, please make sure to subscribe and turn on the bell icon for upcoming videos. Today's video is about Dentinogenesis Imperfecta. Dentinogenesis Imperfecta is a hereditary and developmental disturbance of the dentin which may be isolated or may occur in association with a number of syndromes. Let's understand the concept behind isolated dentinogenesis imperfecta and dentinogenesis imperfecta associated with certain syndromes. As we know that dentin is composed of 70% of inorganic materials or minerals, 10% of water, and 20% of organic material. The organic material is further composed of collagenous and non-collagenous proteins. The collagenous proteins is mainly type 1 collagen, and the genes involved in its production are the COL1A1 and COL1A2 genes. The most abundant non-collagenous proteins is derived from dentin phosphoproteins. And the gene guiding the formation of these proteins is the DSPP gene, or the dentin phosphoprotein gene. Based on mutations in the collagen-forming genes, or the DSPP gene, dentinogenesis imperfecta is divided into three main types. Mutations in the collagen-producing genes leads to type 1 dentinogenesis imperfecta, and as collagen type 1 is the most abundant collagen in bone, so this makes sense that this type of dentinogenesis imperfecta will always be associated with osteogenesis imperfecta. Mutations in the DSPP genes leads to type 2 and type 3 dentinogenesis imperfecta. These two arises in isolated forms and are not associated with any systemic disorder or syndrome. In type 1 dentinogenesis imperfecta, deciduous teeth are most often affected than permanent teeth. The teeth usually have an opalescent color. As type 1 is always associated with osteogenesis imperfecta, patients will exhibit features of osteogenesis imperfecta as well. Individuals will have brittle and fracture-prone bones. Some other features of osteogenesis imperfecta, like bluish sclera, will also be observed. The type 2 dentinogenesis imperfecta is also called hereditary opalescent dentin. It is the most common type and affects both dentitions equally. The type 3 dentinogenesis imperfecta also affects both dentitions equally. In type 3, the teeth exhibits large pulp chambers having little or no dentin. This results in a classic shell-toothed appearance of the affected teeth. The enamel is fractured easily due to the abnormal underlying dentin, resulting in multiple pulp exposures and periapical lesions, like periapical abscess and apical periodontitis. Let's now talk about some common features of all three types of dentinogenesis imperfecta. All three types exhibit broad crowns and narrow constricted cervical area. Enamel is lost due to abnormal dentino-enamel junction. Even after enamel is lost, the teeth exhibit no sensitivity, and this is due to the absence of odontoblastic process in dentinal tubules. Although the dentin is soft and easily penetrable, these teeth are not caries-prone, and this may be due to the obliteration of dentinal tubules, which provides little scope for the entry of cariogenic microorganisms. Teeth exhibit amber-like appearance, and loss of enamel in these teeth results in severe attrition of occlusal and incisal edges. The treatment of teeth with close to normal-shaped crowns and roots can be done with full coverage crowns, or with complete dentures for severely affected teeth. If you think this video was helpful, please like, subscribe, share, and comment your questions or suggestions. Thank you for watching.